keys to stopping what you're seeing here is to stopping the spread of COVID through the most effective means is vaccines. I'm proud to say as of today, Minnesota ranks second amongst the states in terms of adults that have booster shots. Fully 80% of our adults in Minnesota are vaccinated, and we are sixth in terms of the states of our 5 to 11-year-olds continuing to climb on that. We have, and I would tell Minnesotans this, we have sites set up across the state. They are easy access, obviously no cost, for safe, highly effective vaccines. We also have testing sites, and I would encourage Minnesotans getting ready for the holiday here, getting ready for Thanksgiving. Jan will talk a little bit about this. It's critical that you take some common sense moves. Have the conversations with your families about who's vaccinated, who's not, how to make sure that's as safe as possible, and then after the holidays, Jan will talk about getting a few days time in there of getting tested and treating accordingly, and continuing to work on that. And I just can't. Listening to the folks upstairs, I asked point blank, you've been at this for 20 months, how does it feel now? And without a doubt, every one of them said it's worse now than it's been. It's harder on us now than it's been. The people who are here are sicker than they've been, and the pressure and the wear and tear on the staff is as bad as it's been. So these moves that we're making now need to be done. We've talked about an additional $50 million being put into long-term care. You're going to hear from Jennifer D. Cabellos, the CEO here at Hcmc. We understand very clearly this is a triage situation. We also are thinking long-term. We've got the MnSCU system, Commissioner Olson. They're working on training up 1,000 CNAs in the next coming weeks to help backfill where the guard was. And then we have to think long-term of what is in our system is making that pressure. What can we do to ensure it doesn't happen in the future? And how do we train a workforce to be prepared post-COVID for the things that need to be done. But I'm just certainly grateful for the folks here. I'm grateful for this facility. I think it's one of those things that, and I hope Jennifer talks a little bit about this, about how important this facility is to the entire state. And she told me a very, very sobering statistic on the way up with her doctors. Folks from all over the state call for this major trauma center. And the normal thing is to say yes and transport people here by ambulance, by air, whatever it may be. Now we're having to say no, we don't have the space. So I would remind Minnesotans, you may be in greater Minnesota, but to be very clear, the inequities of healthcare now are starting to fall heavily there, where the resources aren't there in many of those places. They're here, and that was a normal procedure where we shared that space. That is not possible now. So God forbid you're in an auto accident and you need to have this care. We can't do it because we're clogged up. And that is something that we saw and talked about months ago, and the need to be prepared and the need to do those things of vaccination, testing, and then protecting this hospital capacity. That is the mission here today. I'm grateful for the person who helps us coordinate all that, and I was very grateful to hear Ms. D. Cabellos talk about how efficient this system was from the time that we requested these DOD troops, and how that process worked and how they ended up here. And the person who makes that happen, Jan Malcolm.
Thank you, Governor. Good afternoon, everybody. I'm primarily here just to answer questions that you might have on all these many moving parts. There's a lot going on to try to respond to the urgency of this situation. But I also want to say there's a lot to be thankful for and grateful for. There have been enormous progress made in the last year. A year ago now, we didn't have vaccines. We've got effective vaccines, we've got knowledge, we've got better treatments. So there's much, much to be thankful for about all the hard work that's gone on. But we are still in a critical moment. And as the governor said, these next weeks with the holidays coming up and all that means for travel and gathering are critical for Minnesotans to keep doing the right thing. We're grateful for the Minnesotans who've gotten vaccinated and who are doing what they need to do and can do, we all can do, to take better care of each other. It is a critical time for people to be mindful of the risk that's out there with this much virus circulating around our state. This is the time to be still doing those basic things that matter. Vaccination number one, getting tested so that you know your status and you can take the appropriate action, but also masking. When you see these workers, these healthcare workers who have been running flat out for 2 years now and what they go through every hour of every day, it's really not too much to ask of the rest of us to be mindful of the impact of our actions on this community. And as the governor said, it is so clear how interconnected all these pieces are. The health of the long-term care system directly affects the health of the hospital sector. And resources like Hennepin that serve the entire state, and we just come to just trust that it will always be there. And now we're seeing for the first time the heartbreaking situation of these people who live to say yes, having to say no. And with that, I just wish all Minnesotans a healthy and safe holiday. Let's be thankful for all that we've learned and all that we can do, and please be careful. Take good care of yourselves and each other. And with that, I'm delighted to introduce someone who's been a colleague of mine for a long time, the CEO of Hennepin Healthcare, Jennifer D. Cabellos.
Thank you, Commissioner Malcolm, and thank you everyone for joining us today. Our commitment here at Hennepin Healthcare to Minnesotans and our commitment across all health systems, this is not a Hennepin Healthcare issue, this is a state of Minnesota issue. The healthcare systems across Minnesota work incredibly well together, and we hear that from other states. We hear that we have a phenomenon here that doesn't exist elsewhere, where we level load, we look out for each other, and we make sure at the end of the day Minnesotans' health is at the forefront. Our mission here at Hennepin Healthcare is to be here for the health and wellness of our community and to be here when Minnesotans need us and where they need us. Hennepin Healthcare, as was mentioned, is Minnesota's largest Trauma I center for adults and pediatric care, and it has unique expertise for the level of acuity we treat here, for whether it's trauma, whether it's life-saving efforts. And we serve, as was mentioned by the governor, the entire state of Minnesota. So rural Minnesota, when they have a trauma that happens and they need a helicopter to fly, get them here. This is where individuals come. And we serve the entire urban and rural area. They rely on us for trauma and life-saving care. Providers across the state rely on our physician expertise to do consults, to call in, to take care. And right now, Minnesotans need to hear us say, demand for emergency and life-saving care has exceeded our capacity. Right now, our reality here at Hennepin Healthcare is we get more than 20 calls a day asking for transfers because of the acuity and the urgency of need to Hennepin Healthcare. 20 calls per day that we don't have the capacity to answer. We have 20 on any given shift waiting in our emergency department trying to get upstairs into inpatient care because they need ongoing medical care. And as was mentioned by the governor, we have 40 that are waiting to get out of our hospital walls to their next level of care, but they need ongoing supports in our community. And so we are grateful to the governor, to Commissioner Malcolm and the MDH team, to our federal partners for making sure that we can still be here to respond to Minnesotans. And I want to just emphasize, when we exceed capacity, it doesn't mean people get turned away. It means we stretch our team members. It means we leverage other expertise. It means care access can take longer. It means rural Minnesota hospitals hold on to care that they don't have the expertise for a little bit longer until they can get somebody where they need to be. Transfers not happening is not ideal, and it can be life-threatening. And that's what we saw walking through the emergency department today, is every minute matters in some of these traumas. So we need all Minnesotans right now, all Minnesotans to stand up, to stand together, and to protect our limited and vital emergency resources the best we can, so that no one in Minnesota is faced with a life-threatening need without optimal care and recovery supports immediately available. We're grateful to the governor, to Commissioner Malcolm, to our federal delegation who advocated, to President Biden and the federal team who deployed. I can't say enough. We put a call for help on Friday. By Saturday morning, we had a phone call response that said, we're meeting with you first thing Monday morning. Monday morning, we debriefed and shared what the reality was here at the health system and the worries our providers have about care that they couldn't accommodate. By Tuesday, we got a phone call that said, federal team is coming, and can you be ready on Saturday? And we welcomed them within 7 days. That is an incredible government response that we are so grateful for. Our commitment, as we care for Minnesotans, is to be here when Minnesotans need us most, as we've done for over 130 years here at Hennepin Healthcare. We shared with the governor and Commissioner Malcolm earlier that we just saw a chart from our trauma team this morning that showed an alarming rate. This is an organization that is not used to ever saying no. And over the past couple months, we've had to do that over 400 times. We've had to go on a diversion for an organization that takes pride in always being here. So I want to emphasize that even though our federal supports are here and we are so grateful for them, it is a short-term solution. We need to play the longer game across Minnesota right now. Vaccinate, get your boosters, reduce high-risk behaviors, so that as a state, we can ensure each other that healthcare systems can respond when you or your loved one has a life-threatening emergency. And we can't emphasize that enough and say thank you for the teamwork. With that, I will pass on to Lieutenant Colonel Shealy.
Good afternoon. I'm Lieutenant Colonel Shealy, the officer in charge of the medical response team here today. We are here at the Hennepin County Medical Center in support of the Federal Emergency Management Agency at the request of the state of Minnesota to assist medical providers with the latest surge in COVID-19 cases throughout the local community. There are currently 23 active duty military medical personnel here from Langley Air Force Base, Virginia, and Offutt Air Force Base in Nebraska. Our team consists of military doctors, nurses, and respiratory therapists, bringing with them an abundance of medical experience and knowledge. Their expertise, coupled with that of the Hennepin staff here, will prove invaluable as we work together to tackle the rise of the coronavirus hospitalizations in the community. Since our recent arrival, the Hennepin staff have gone above and beyond to ensure the seamless transition and integration of our service members into the hospital team, to include credentialing, training, and orientation in just the few days that we've been here. And for that, we are extremely appreciative. We remain committed to supporting the Minneapolis and greater Minnesota community as we work to help relieve the pressure on the healthcare workers that are overwhelmed by the coronavirus pandemic. The duration of the support here will be determined as the situation evolves, but our team of highly qualified military medical professionals remain committed to assisting for as long as needed. Thank you so much for having us here. We are delighted to be here in support of the local teams, and we will do our very best to get through this together. Appreciate it.
Thank you. Thanks.
Okay, thank you. Hey, good afternoon. I'm Major General Hcmc, the Adjutant General of Minnesota National Guard, and am humbled and honored to be the leader of the over 13,000 citizen soldiers and airmen that we have in the Minnesota National Guard. Our state and nation have been extremely busy since March of 2020 with the COVID pandemic, and as Governor Walz has tasked us numerous times to assist in this both at the state level and at the community level. You know, and our service members in the Minnesota National Guard, as opposed to Lieutenant Colonel Shealy's, we live here, we work here, and as evident in the last 18 months, we continue to serve here on a daily basis. So to the Minnesota National Guard, soldiers and airmen, thank you for what you do professionally, and thank you for serving with dignity and respect. Unfortunately, the pandemic is once again placing significant strains on the healthcare community, as evidenced today. And yesterday, Governor Walz activated Minnesota National Guard to provide skilled nursing response teams to assist facilities experiencing severe healthcare staffing shortages. Together, the Minnesota Department of Health, other professional partners such as MNSCU and other technical universities, and the Minnesota National Guard medical staff will train selected service members as certified nursing assistants and technical nursing aides to support this activation. Initially, there will be 400 Guard soldiers who will receive this training, but there are plans in place to expand that if the demand is needed. To our soldiers and airmen remain our greatest asset and our most valuable resource. I acknowledge that we share this tremendous resource with the employers of these servicemen. The Minnesota National Guard is primarily a part-time force, and these activations can disrupt businesses and organizations. National Guard men and women at their core are part-time airmen, but are full-time members of our communities. When they take off their uniforms, they serve as business members, bosses, teachers, coaches, community leaders, and skilled trained workers. serving their country and their communities at the same time with duty and honor. To our employers, I would like to express my sincere gratitude for your continued support. We appreciate the employers of our citizen soldiers and airmen. We could not do our federal mission, our state mission, or our community mission without your support. Finally, I want to thank the families of our service members, as they have to adjust their lives during these activations. At times it can be difficult. We are thankful for their support and commitment to their loved ones, and are forever indebted for their sacrifice as they continue to support our soldiers and airmen. Thank you.
Thanks, General Mankey. Well, as you can hear, this is an all of government, all of private sector, all of public sector approach. We are laser focused on the surge that's upon us. We have the tools to push this back, the vaccines, the testing, and then the protection of our professional healthcare facilities. I am grateful for the help from the Biden administration, Lieutenant Colonel Shealy and his team that is here to assist us. And as General Mankey said, time and time again, we rely on our neighbors in the National Guard to be there to help us. So I would tell Minnesotans, once the pandemic started, our pledge to you was to provide you the health care should you need it. We're doing all we can. I need your help. I need you to have the conversations about those that are unvaccinated. Thanksgiving might be a good time. Thankful to be together with family. As Jan said, there are many things to be thankful for. But we also know that we're in the grip of this. And the decisions that we make as individuals, the decisions we make around gatherings, the decisions we make around vaccinations and testing has a direct impact on the entire system. And the next few weeks will be critical. So I would encourage you to enjoy that time with family, but to think about how you're going to do that. Might look slightly different, but certainly we have the capacity to do it. And so we're going to get through this, Minnesota, as we always do. We'll keep our kids in school, keep our businesses open, keep folk healthy, and make sure that we show that gratitude towards the healthcare professionals. With that, I think any of us would be glad to take questions.
I have a question for Jennifer. How do the 23 military medical professionals fit into the overall staffing numbers here at HCMC?
So what we will be doing is, in response to this, opening up an additional 6 step-down beds from our ICU, so our intensive care unit, to allow us to step down to an intermediate level of care, which allows us to then move individuals who need ICU care from our emergency department into that unit faster. So it's a throughput issue. It's how do we get more capacity, leveraging the team members that are here. In addition to that, we have a 10-bed admitting unit that we are staging in the space behind us right now, which will also allow us to not hold individuals in the emergency department so they remain open to traumas that are coming in. As we were coming over here, there were some being called in. So that's how we'll leverage the resources and the team members, and they'll work right alongside our team members in order to be able to provide care to more beds.
And you have the beds, it's really just the staffing issue.
We are already holding over 40 beds beyond what is normal for the health system. So we've pushed ourselves as far as we can go. And now as we see the backup, these additional team members will help us extend that even further.
Downstairs or wherever we were when we first got here, in the blue building, you said something to Governor when we were talking kind of on the side about the number of acute patients and the history of the hospital and where we are right now. Can you kind of go back? I think you alluded to it a minute ago, but kind of
The case mix index.
yeah, but sort of tell that in layman's language.
So the case mix index in healthcare is a way that we watch acuity. How sick are individuals who are in our bed? Because it tells you how many resources and what level of team acuity you need as well. And our case mix index is higher than this hospital has seen before. And it's consistent, which tells us that the individuals within our walls are individuals that are incredibly sick and require larger teams often to care for them.
So of your 20 calls a day, how many of them are COVID related?
I would defer to, is Dr. Hoodie still in the room? He is. Dr. Hoodie has been taking our call transfers, in particular this past week.
So about a quarter to a third.
Tell us who you are, sir.
Oh, Dan Hoodie, the interim chief medical officer here at Hennepin.
Say and spell your first and last name just for the tape, please.
DANIELHOODY.
So roughly 5 to 8 a day are other.
Yeah, it varies depending on, it waxes and wanes, but our range, I think, probably 5 to 50 between emergency department and inpatient transfers on any given day, and then About a quarter to a third of those are COVID.
But just to kind of encapsulate what you're talking about today, we're meeting these troops that are going to do this work at Hcmc. Also, you're talking about expanding the capacity of beds, right? So it's kind of all in one. There's a lot going on here. I don't know if the governor or
There absolutely is a lot going on, and go ahead.
Could we, if you're comfortable, if we could remove the mask when we talk, it helps with the microphones.
Thank you.
Thank you.
There is a lot going on, and it is, so the unique expertise here at Hennepin Healthcare is heavily the trauma. It is that life-threatening. It is, I have an illness that every minute, every second counts. So when we're taking transfer calls, it is usually because of that acuity. That acuity may be COVID-driven, it may be other need-driven, but as we see COVID increasing across all healthcare systems, including ours, what you see is the inability to care for that higher level of acuity and the higher level of need, which pushes more calls here because other systems can't handle them because of what they're responding to.
Jennifer and Dr. Hoodie, maybe this answer will make your point for you, but does anyone know what happens to those 20 people who are getting turned away a day? Are they still alive? Yeah, I mean, literally.
No, it's a good
Yeah,
question.
no, it's a great question, and
go a little more?
so it's very common to hear that when people are calling for help, whether it's at Hennepin, other major health systems in the Twin Cities, that they've already been down the list. We're off a number 10, 15, 20 of calls they've made on any given patient, and so presumably they're going through the list and then finding at some point an open bed.
Dr. Hoodie, is this like an automobile accident in a rural community? They went to their local hospital.
Correct.
They tried to go to Mankato. Mankato was full. They tried to come here. Is that how this works?
Correct.
So
And
what happens, and I think Theo's question is good, they're not being left outside the door, but
No.
the care to get to that. I think that's what people are looking at. To try and make this case, I'm trying to help explain it too, about where this is a domino effect of what happens of these COVID cases to make that happen.
So the stay in the sending facility will often be extended well longer than we normally would. And from a level 1 trauma standpoint, we obviously have partners in the Twin Cities, so regions in North Memorial as well. So if it's something requiring level 1 trauma, they'll presumably get into one of those facilities depending on where the access is at any given point in time.
Okay, thank you. And Commissioner Malcolm, you had said last week that there were other hospitals beyond Hcmc and St. Cloud Hospital who had requested. Are there more federal teams coming to those hospitals? How many hospitals are there?
Well, thank you. I do want to underscore that point. The two teams that were deployed, one here to Hennepin and the other to CentraCare's St. Cloud Hospital. The reason why those two, I think the folks who run this program federally, the Assistant Secretary for Preparedness and Response, looked at the situations and thought from a geographic perspective and the impact of the unique trauma resource, the geographic perspective that this care is really pressed in outstate Minnesota as well, was the reason those two were selected. And we just want to say, just about every hospital in the state is in a tough shape in terms of how stretched thin they are, how hard their workers have been working for 20 plus months now. So everybody needs the help of Minnesotans to understand what's going on and to do what we can do to take pressure off of all of our hospitals. In terms of more federal teams, unfortunately, you're seeing the cases nationwide now starting to tick back up again. And that's of deep concern going into the holidays here. So while we have additional hospitals that would love some of these federal teams and will keep asking, the reality is that these federal teams are in great need all over the country. So we're not counting on getting more, but we certainly will continue to make that ask. If they're available, we have other hospitals very well qualified and interested in having them.
And just to clarify something, are there 23 people who are part of this, are they split between St. Cloud and Hcmc?
Glad you asked. These are two teams, so each team is 23. So this is a significant expansion of capacity, and as Jennifer said, we're very proud of the level of collaboration among our hospitals and health systems around the state. What helps Hennepin and what helps St. Cloud helps everybody from the standpoint of this constant level loading that's going on.
Commissioner, you
talk about other hospitals that would love these teams. Could you throw out a couple regions of the state that could desperately use these teams?
Well, I think again we're trying to balance the needs of the regional health systems, the Greater Minnesota, because you've heard some very compelling stories of how their lack of capacity is creating real problems in access for all kinds of care, not just COVID. We keep saying how many COVID cases, and it is COVID that's tipping these hospitals over the edge, but they're very, very full of very sick people for a lot of reasons as well. We watch case growth rates all over the state. The northwestern part of the state and the west were the hottest, if you will, for a while. It's moving into the central, but really remember, just about every Minnesota county is in CDC's high transmission range. So there isn't anybody that isn't stressed right now. This, I think, these first two teams with Hennepin and St. Cloud will really help to balance geographically that load.
So let's do one more, and then we're going to go behind here so you all can see the decompression site and where the extra pieces
So this is not a real question, and I'm not going to count it as real because it's only, is it 2 weeks? That's not a real question. Is it 2 weeks?
That the teams will be here?
Yeah.
I think, as the Lieutenant Colonel said, that will depend on the need, but I think the deployments are typically for 30 days. Is that right, Lieutenant Colonel?
That is kind of a real question.
I know.
No, please, go ahead. No, you're here. We're glad to answer them.
Really quickly,
Sure.
is the special session, is that on the table at all in light of Senator Miller's comments? And does the legislature need to do anything to help? You called for action on some nursing homes.
Yeah, we
Is
could
there anything that they need to do?
we could probably use it, but that was 60 days ago. Preparing for that, we've kind of moved to beyond that when it didn't come. We'll see. I'm always open to hearing on this. I think one of the things the legislature misses is that real life continues on. We've been working on this, calling the White House, training the Guard up, doing things, expanding testing, expanding vaccinations. So we're using the tools that we can right in this moment. If it works, we're certainly glad to be there, but we just can't spend a ton of energy on that right now in the midst that we're in.
Do you think you'll?
Are you honing in on an agenda for the special session now that Republicans are taking?
I sent it to them last week. They just need to do the essential worker play, do some drought relief, and provide the things that we needed in the hospitals. They kept wanting to add other things. This crisis was upon us. I hope all of you are reporting this too. When I sent the letter back the last week of September, in that letter it stated that in October, end of October, into November, the way COVID was looking, we needed those things done, so we were on the front end ready to do this, and did not get any response. So, the list was out there. It's very simple. Any special session, you just agree on the things you can agree on, disagree the others. But the focus for us is to make sure we're continuing to do this work. We have the tools necessary to do it. We could certainly use some of that help. But as I said, some of those smaller things on the waivers, the situation has peaked now in November. A lot of those things were meant before the peak to try and help with that, and those passed by.
So
Will
maybe
you
no
call a
special.
special session? Will you call one?
Not until we have a solution on this. I'm not getting in the middle of everything we're doing here. It's just not settled. I need to have stability in my public health team. We need to make sure we're doing the things necessary, and that's what we're doing. And I'm focused on this, and grateful that it appears like many of these things are in place. But it's going to be a challenging couple weeks, but we can get there.
Thanks, everyone. We're just going to go
Thanks,
right
folks.
down here.
Happy Thanksgiving to everyone.
I would just say, leave your sticks here so that we'll watch them, so cameras only, and it's kind of a tight
Great.
space back there. So cameras can follow Christine.
Thank you.
We're interested in seeing what you're the governor.
It's Chris Cabellos.
Hi, Chris.
Nice to see you. Just real quick, what's your take on what are the numbers looking like? Hospitalizations?